For many of America's pregnant women, the excitement of a new baby is overshadowed by concern over their ability to access proper prenatal care. In recent years, the closures of regional hospitals and maternity wards and the movement of providers out of low-income areas has led to maternity care deserts. These are areas where many women have to travel long distances for prenatal care or can't access care at all, significantly increasing their chances of pregnancy-related complications. The result? A burden of accessibility. Only 45% of U.S. hospitals offer obstetric care services, and nearly 50% of all counties lack a single obstetrician. And oftentimes, a lack of regional care is exacerbated by growing gaps in insurance coverage. All pregnant women everywhere deserve care. That's why March of Dimes and RB's Info portfolio of brands have formed Better Starts for All, a multi-year initiative to promote healthy pregnancies and deliveries for all moms. The Better Starts for All initiative aims to ensure all moms and babies in the United States thrive regardless of social, cultural, and economic disparities.
Women who live in maternity deserts face significant challenges, both economically and socially, including poverty, food insecurity, substance misuse, and smoking. Prenatal care in this time period is so important for a healthy pregnancy, as well as it starts that infant's development in the womb. As a physician scientist at the University of Cincinnati, as well as a mother, I am committed in getting women that best nutrition to provide those healthy outcomes. I am so inspired by RB's commitment with the March of Dimes and the Better Starts for All to truly bridge that gap for access, for getting women this health care they deserve. We have mobile units as well as digital opportunities with telehealth and group support to really get these women that health care they deserve to have that best start in life.
March of Dimes works tirelessly to ensure that every mom and baby have a healthy start, regardless of race, income, or geography. Our Better Starts for All initiative will drive support, education, clinical care, and virtualized care to at-risk women in maternity care desert populations. We are excited about the opportunities that Better Starts for All creates to improve access to care. We're thankful for RB and Info's portfolio of brands for setting up Better Starts for All and for committing to fundamental change in U.S. prenatal care.
At RB, we're driven by our purpose to protect, heal, and nurture. At INFA, we leverage our more than 100 years of nutrition experience and industry-leading science to create products that support developing minds and bodies. Our involvement in Better Starts for All underscores our dedication to taking a stand for those most vulnerable in our country, because we deeply believe that all moms and babies should have access to the education, resources, and care they need and deserve.
Join us in our mission towards ensuring all mothers and babies have the best start in life.
Hello, everyone, and thank you for joining us today. My name is Dr. Christina Valentine, and I'll be your host throughout this program. I'm a neonatal physician with 19 years of experience caring for newborn children. I'm also a researcher dedicated to reduce preterm birth at the University of Cincinnati, and I serve as the medical director for RB, specializing in nutrition. I'm so proud to work for a company that invests in communities of need. I am thrilled to take part in the Better Starts for All initiative because it really aligns with my passion and my vested interest in the medical well-being of both mothers and babies. We're here today to discuss maternal care across the nation, and in particular, the launch of a program that is very near and dear to my heart, Better Starts for All. Better Starts for All promotes healthy pregnancies and deliveries for all moms. RB's EMFA portfolio brands and the March of Dimes have made a staunch commitment to this vital cause because we need additional support in order to extend this work to every community that needs it. All is a small word with a huge facility for unifying us as a community when it's applied right. Currently, we are not doing a great job of applying the concept of all across our maternal care systems nationwide. For our program today, we've gathered as medical professionals, policymakers, and concerned citizens of every stripe today to investigate how we might make this tiny word all live up to its giant meaning a bit better in some of our nation's invisible maternal deserts. Our aim today is to expand our understanding of the need for extending access to basic medical care to all mothers and babies in every area of the country. This matters for many important reasons. Where would any of us be without our mothers? If you're a parent or caretaker, how would your life look without those precious, wonderful kids? To us in this moment, it's just a terrifying thought. For so many mothers across America, it's a heartbreaking reality and one that absolutely does not have to exist. The way we treat women and children is a direct reflection of our most sacred values as Americans and as compassionate human beings. We can no longer turn our eyes away from the fact that we currently have a maternal care system that turns a blind eye to mothers and babies in need. When we truly all work together, we can help all moms thrive, regardless of social, cultural, or economic disparities. Our advocacy must cross profession, industry, and public health policy. Today, we've gathered experts across the spectrum to talk about this maternity care crisis in this country and what we can collectively do together to address these inequities. You will hear from medical and political leaders, including March of Dimes Chief Medical and Health Officer, Senior Vice President, and Interim Chief Scientific Officer, Dr. Rahul Gupta, New Jersey Senator Cory Booker, and other policymakers who will share the importance of all of us working together. Today's discussion could not be more timely, as a number of the representatives you'll hear from today have spearheaded and supported the Black Maternal Health Momnibus Act of 2021, which was expanded and resubmitted this month to Congress to address the dire state of maternal care in our country, an issue only exacerbated by the COVID-19 pandemic. The 12 bills within the Act call for urgent and targeted investment to address the maternal mortality and morbidity rates and save the lives of moms and babies in this country by allocating funding for community organizations and state and local governments to improve maternal health outcomes and promote this equity, creating and expanding training programs to address bias, racism, and discrimination in maternity care, and growing the perinatal workforce. The Act also aims to increase targeted investment in addressing social determinants of health that influence maternal health outcomes like housing, transportation, and nutrition. We'll also hear from team leaders in our first two markets, Southeast Ohio and Wards 7 and 8 in Washington, D.C. We'll hear from new moms in those areas about the care they receive and areas where they see a need for improvement. It really does require all of us to make a difference. And I personally want to thank all of you for being with us today. Please consider following the Better Starts for All on Instagram and get involved by visiting thebetterstartsforall.com. You can learn more, where to volunteer, where to help advocate, particularly for policies like the Momnibus and other legislation supporting maternal health. Let's kick things off now with messages from Senator Cory Booker and Dr. Rahul Gupta, both of whom can help us open this conversation with a level of sincerity and a focus that will hopefully forge a path toward shared solutions.
Welcome, everyone, to this very important discussion about the maternal health crisis. I want to thank the March of Dimes and everyone who helped to make this virtual gathering, so possible. I want to let everyone know that we are in a time, as you do know, the time of pandemic, a time of health crisis and economic crisis. There's much going on right now, but we cannot simply focus there and not do more to deal with what has been a crisis for over a generation now. The fact that the world's wealthiest nation has, amongst industrial peers, the worst rate of maternal deaths during childbirth. This is a shameful distinction. And what compounds the shame is that most of these deaths are entirely preventable. They are a result of policy decisions. I believe that one of the most challenging poverties we have of our time is a poverty of empathy and a poverty of action around those issues that we have the power to deal with together. And so I am so grateful that we have come together for a discussion, but even more so, I'm grateful that we've come together with a sense of conviction that we can do more than just discuss this problem, but we can put together a plan to alleviate it. That is the call of our country, to recognize that we are all in this together, that we need each other, and that when we focus on the well-being of all, we all triumph together. So thank you for your focus. Thank you for your conviction. Thank you for your determination to end this shame and bring about a time of glory, a time where we live up to our values and our ideals of life, liberty, and the pursuit of happiness, and justice for all. Thank you so much.
Hi, my name is Rahul Gupta. I'm the Chief Medical and Health Officer, as well as the Senior Vice President at March of Dimes. Since the pandemic began, many people are more apprehensive about visiting their doctors to get maternity care they need, in fear of being exposed to the virus. There's also been an increased concern over maternal care inequities due to women being out of work or having to sacrifice their careers for the needs of their children who are now learning from home, which is resulting in a loss of employer-sponsored insurance. While specific regional challenges play a role in the prevalence of maternity care deserts, there is one clear commonality. Many pregnant women in the United States cannot access the healthcare they need to deliver and raise healthy babies. Knowing this, RB's ENFA portfolio of brands and March of Dimes selected 2 regions to focus initial Better Starts for All efforts: Ward 7 and Ward 8 in Southeast Washington, D.C., and 10 counties in rural Southeast Ohio. Through research, we found these regions over-index in serious health concerns that impact a woman's pregnancy and the health of her baby. By focusing efforts in these 2 areas, Better Starts for All hopes to quickly understand how to best service these 2 different communities and glean learnings for expanding and activating the initiative on a national scale to reach more communities in need of greater access to pre- and postnatal care.
Joining me today are Better Starts for All leads, Ms. Mallory and Pari Quarles for the Washington, D.C. area, and Dr. Abra Greenberg for Southeast Ohio. Although they represent two highly different regions of the country, we'll hear similarities about women's lack of access to healthcare and maternal mortality, as well as steps these leaders are taking to balance that equation in these first two markets. Hi, Mallory. So great to have you with us today. Can you start by giving us an overview of the health of moms and babies in wards 7 and 8 in Northeast and Southeast DC?
Yes, sure. First, let me just say how delighted I am to be here with you all today to really elevate the health of moms and babies for our community here in DC and beyond. To answer your question, we are certainly currently experiencing and witnessing a national crisis in maternal and infant health that hasn't spared our nation's capital. In DC, the rate of maternal mortality is actually one of the highest in the country and remains more than 50% higher than the national rate. So just as a point of reference, in 2018, the 5-year average maternal mortality rate here in DC was 36.1 deaths per 100,000 live births. And given that we typically see rates in the teens in other developed countries, this really is a figure that most people certainly would not associate with a city where so much economic, social, and of course, political power is focused.
That is definitely shocking and saddening to hear, but thank you so much for giving us that reality check, because all too often it's our preconceived notions about a place that keep us from investigating its issues and pushing it to become what it could be. Dr. Greenberg, I'd love to also welcome you into this exchange. We are so glad you're here. Can you chime in and let us know how those numbers from Mallory's compare with what you're seeing in Ohio?
Absolutely. Hello, Dr. Valentine. Thank you so much for having me, and hello to everyone. So glad you could be here. In Ohio, we're experiencing the maternal and infant crisis firsthand. Statewide, 1 in 10 babies is born preterm. Several of our counties have even higher rates than that, upwards of 12 and 13% showing up in Vinton and Meigs counties. We are also seeing unbelievably high rates of maternal mortality and morbidity. The saddest statistic of all of this is that 50% of these maternal mortality cases are preventable. So there's a real tremendous opportunity to really have a fantastic impact in this area.
This is just unacceptable. What do you think some of the factors are contributing to those numbers? Could you each comment on that?
Sure. What we know is that when we look at maternal health, particularly through the lens of race, ethnicity, there's this wide disparity in terms of both access to quality care, but also with respect to the outcomes that we see. So Black women fare far worse than their white counterparts. By way of example, here in DC, there are about 40 facilities that provide prenatal care, and they're not evenly distributed across the 8 wards, the 8 sort of political districts in the city. So in Ward 2, for example, which is the home of the National Mall and some of DC's oldest neighborhoods, we see virtually 0 maternal deaths. And this area alone contains about 12 prenatal care facilities. If you compare that to wards 7 and 8, where I'm doing a lot of this work for Better Starts for All, 90% of those residents are Black, and each of those wards has only 4 facilities. So there really is this mismatch in terms of resources across the district that is then, of course, reflected in who is carrying that burden of poor maternal health outcomes. And this trend is upsetting, and unfortunately, it's similar to in terms of the distribution of maternity wards and other birthing facilities for pregnant women in the city.
And for us in Ohio, the disparities are primarily socioeconomic. Many counties in Southeast Ohio rank among the worst in the state for health factors such as health behaviors, clinical care, socioeconomic status, as well as physical environment and health outcomes. So naturally, all of these factors compound the impact for moms in this region, resulting in a heavy burden of morbidity and mortality.
It's certainly a connective thread through the Better Starts for All efforts. The devastating realization that when times are tough anywhere, they're almost always toughest on women and kids. Mallory, can you talk a bit more about access to providers in DC?
Sure, absolutely. So overall, DC does not actually have a shortage of providers. There's just a huge disconnect. Across the district, providers are again unevenly distributed, and there's limited access, particularly east of the Anacostia River, especially to clinicians who can accommodate the needs that pregnant people have if they're experiencing a high-risk pregnancy. Additionally, DC is facing a challenge, I would say, especially in terms of the quality of experience when it comes to the existing care landscape. So many women report feelings of not really being heard, of not being understood by their providers, or feelings that when they do speak up, their concerns are dismissed or discounted, which really speaks to the underlying and universal problem of systemic racial and gender inequalities and inequities. Our system really currently suffers from a lack of options that are culturally competent and culturally congruent. And we also have a lack of flexible options that are really sort of responsive to the needs of pregnant people as they see them in their community.
Thank you so much for pointing out the complex and multi-level nature of this issue. We need to be able to look at the problem from all angles if we hope to understand and permanently resolve it, rather than just sticking a Band-Aid on it. Dr. Greenberg, I think it's somewhat of a different challenge in your area, isn't it? Can you describe the maternity care deserts in Southeast Ohio?
Sure, absolutely. And I have to say that, I have to say that desert is such an accurate description for this area. 20% of the Ohio population is rural with lower access to care, decreased level of insurance coverage, and they experience poorer health outcomes as a result. Earlier, we were talking about the fact that there are counties that don't have a single OBGYN in the county. And we have two of those counties in Southeast Ohio, Perry and Vinton counties. There is no care, there is no access to care for these women. And oftentimes women have to travel up to an hour, maybe even an hour and a half to Columbus and Cincinnati to seek care. This lack of access to basic prenatal care results in missed or delayed diagnoses. It increases the risk of poor health outcomes, including pregnancy-related death. Transportation is a big issue as well. With these counties being very rural and they require this extended travel to reach these providers, it's incredibly problematic. There is no good public transportation infrastructure. Oftentimes families don't have cars or they can't afford the gas to put in the cars. It's a common barrier and a big challenge. Another barrier to care is insurance coverage. The percent of uninsured pregnancies is more than twice as high in Ohio's rural areas as it is in areas that are urban. And just in terms of statistics, we're looking at about 7.5% in rural areas as opposed to about 3% in more of the urban areas.
Those are shocking disparities. Thank you for painting such a vivid picture of the barriers women and children are facing in your area. Can you tell us a bit more about the role substance abuse disorder plays in all of this at your local level?
Absolutely, and that's a really important point to bring up. Substance use disorder has been a challenge in the area for a really long time, and it's on the rise. Rehabilitation services are available, but there are a few supportive services beyond that. So housing, transportation, food, it's still a challenge. For example, if someone tests positive for substance use while in a program, they may be kicked out of the program with little to no options of other help to get them on that road to recovery. And to make matters worse for women and children, there are so very few, if any, residential programs available for new moms and their newborns. Pregnant women are prioritized by the state, but their male partners are not. And so there is a challenge to get that help for substance use. And we are assuming that these women are actually seeking care. Sadly, pregnant women with substance use disorder are further reluctant to seek care due to the risk of potentially damaging consequences, like losing custody of their children. In addition, they face stigmas from healthcare providers. It's very challenging and upsetting and difficult for these women to feel comfortable to reach out and seek the care that they really need.
Maybe you could each comment on how the Better Starts for All programs are going to fit into the landscape of the options currently available. How do you see them complementing the work being done on the ground and making an impact? Mallory, maybe you could go first.
Sure. So through Better Starts for All, we are really considering how all the factors, including the systemic, socioeconomic, and infrastructure challenges we've talked about a little bit today, how that's all really the backdrop to the actual program delivery. So for example, we're working with several provider partners and we're offering implicit bias training to those partners to ensure that as new programs are implemented, they've at least begun to have conversations within their larger systems, within their organizations, that can help address how implicit bias impacts the provision of care, and specifically to sort of work to improve communication and trust building, of course, with their patients, but also with the broader community that they serve. Additionally, we're really excited about launching Becoming a Mom, which is a program that offers virtual prenatal education and support. And this is especially timely given the pandemic. It's exciting to be able to expand opportunities for women and pregnant people to get the social support that they may be missing while social distancing and while also receiving some information that can really help shape a healthy pregnancy. We're also providing health services through our Mama and Baby Bus, which we saw a few clips of earlier in the program. In terms of landscape of options, there are existing mobile health services in DC. So this is a model that people are comfortable with. There's COVID testing and pediatric care available through other mobile vehicles, but our vehicle really complements those options by offering prenatal, postpartum, and reproductive health care. And we're working with community sites on the ground as key partners for spreading the word about this offering.
And here in Ohio, we are also working towards a mobile health service. We have a great partner with the Ohio State Wexner Medical Center, and they're going to be focusing on Jackson, Meigs, and Vinton counties. And the bus is going to be providing low-risk OB care in collaboration with providers with a local regional hospital. And we're also going to be able to facilitate access to specialty care via telemedicine to improve access for those high-risk patients, including those with chronic conditions. We have also partnered with O'Bleness Hospital, which is part of Ohio Healthcare System, and they're located in Athens, and they are piloting a fantastic program with community health workers. And they are going to focus on women living in several of our target counties, including Vinton, Perry, and Jackson counties, that really need that extra assistance to put all those resources together for these moms. And this is exactly what that program is going to do. Lastly, we are also planning to incorporate supportive pregnancy care. And supportive pregnancy care is an evidence-based group prenatal care model that brings pregnant individuals together for prenatal care with their obstetric provider. During these group sessions, participants take and record their own vital signs. They receive a private physical assessment from their provider. And then there's the support that is so needed for these women. And they have the opportunity to share their experiences and gain some knowledge and skills related to pregnancy, birth, and infant care. Supportive pregnancy care offers a flexible group prenatal care model that focuses on social support, health education, and skill building, all in that group experience. And through Better Starts for All, we are also building that virtual model of supportive pregnancy care that will enable us to reach women in these maternity care deserts without the transportation barriers that exist with in-person care. So we are hoping to enable socially distant education, care, and support.
I want to just congratulate both of you on the extraordinary efforts you're making in your areas. Ms. Mallory Empari in Washington and Dr. Abra Greenberg from DC. There's no question that this work is going to improve maternal health, but it shouldn't solely rely on your shoulders. We know that regional healthcare providers and health systems are vital in all communities. If you're a healthcare provider located in DC or Ohio, I'd like to encourage you to get involved in this mission. Please email Mallory or Dr. Greenberg. Our local mission leads directly to getting involved. Our goal is that more systems become aware of the success of our pilot communities so they can develop and implement innovative approaches to expand this access to care in this region. Now, to that point, let's get a quick read on what the consensus believes the actual availability of care for women across America is. We have a poll for you to participate in. On the right side of your screen, click the Stage tab, then click Polls. Take a peek at the question. I think we can probably all agree that the fact that the answers are all in the millions is going to be answer enough to the girth of this issue. How many women in the United States live in counties without access or with limited access to maternity care? 10 million, 7 million, 3 million, 1 million? If you answered B, 7 million, you are correct. Unfortunately, that's 7 million women that have nowhere to turn for reliable care when they're at their most vulnerable. It's so inspiring to see the great work the team is doing in Washington, D.C. and Southeast Ohio. And I know so many will benefit from these services, but that's only one side of the story. Up next, we're going to hear from those who are traditionally voiceless in these maternity care deserts, the mothers themselves. You'll see videos from a new mom in Washington, D.C., an expectant mother in Southeast Ohio. Both of these brave women will describe their journey and their experience that can help us gain a deeper understanding of the challenges they have faced in finding prenatal care and education. Most importantly, I think, these mothers put a genuine face to the meaning of the Best Starts for All initiative and why unique interventions like this are so important for expecting moms.
I picked up a leaflet from my doctor's office. And so I didn't know where to turn to for resources, number one. Number two, I didn't know what kind of questions to ask. And of course, my OBGYN, all she said, you're doing great. The baby looks great on scan, and you're progressing all along very well. But that wasn't enough for me. These services fill tremendous gaps for different types of people. You hear your friends talk about their journeys as mothers or parents, but they don't really go into details. You don't know whether you should ask about this tingling in your feet, whether it's normal, or this thirst, or, so there's some questions that you're not comfortable asking your friends, but at the same time, you want to know whether it's normal, and then you turn to Google. Google gives you different answers. So when you have resources like March of Dimes, these ladies were awesome. They made me feel comfortable. They would stay longer than the scheduled hours to just answer questions. And they even availed me private, personal emails, personal phone numbers to ask questions any time of the day. If I felt like one of the things you feel as not a first time, I'm sure all moms, tightness in your legs and muscles and stuff, and cramping and what to do. And these are things that, they had experience in and they would guide me. I would definitely recommend services like March of Dimes to other expectant mothers. And even as I build and expand my family, I'll turn to March of Dimes. One, because it's free, Most free services are normally subpar or have very little information, or people don't have so much time to focus on your issues or your needs or go far above and beyond to be like, call me any time of the night. Where do you get that? Normally that's paid services. So it's free, it's quality, and it's personal. For me, these are key things that I look for, even for paid services. But to have these available to you at a free service, it's really phenomenal.
I've turned to my OBGYN for information And there's also been some really great resources through the March of Dimes program. It's been an extension of my community, and having someone else who isn't like a parent or a family member, a friend, but someone who is knowledgeable, and it's not just their opinion of, oh, you need to do this. It's really nice being able to talk to someone who's unbiased. When I see the March of Dimes, I know that this is credible information. It's researched information, and it's accurate information. And as a new mom, that's what I want. I don't want to waste my time sifting through all these different things on the internet. I can just go there and I know the information I get is going to be right. The online classes have really helped fill in those gaps of not being able to go in person and getting that help and support, and then getting input from other moms and their experiences is super helpful. And it kind of gives me that sense of like, okay, this is gonna be okay. I'm not in this by myself. I have this extra support system. And like I said, having an extension of a support system right now is fantastic.
Now that we've had gained insights from our Better Starts for All leads in Washington, D.C. and Ohio, as well as the moms in those areas, I'd like to turn the conversation to our healthcare providers in these areas. Let's start by listening to D.C.-based midwife, Billy Hamilton Powell. Ms. Hamilton Powell is here to share with us her experience with Better Starts for All, mobile services in wards 7 and 8.
There have been some hospitals that have closed near the border of Maryland and DC, which makes it harder for women in DC to actually get their prenatal care or get to a hospital. And so that has made it a problem, so that women in DC have to go further to go get their prenatal care or go to a hospital to have services. And that's why this bus is so important. I want to make sure that they don't feel as though they are being left out of the system. So what we want to do is say, hey, we know about you, we care about you, we're going to bring it to you. We want to make sure that we're in areas where we know women we're going to be and make it convenient for them. I have a little sanctuary here for them to come into. Is a nice thing to be able to do and say, you know what? You can leave all of your problems out there, because here nobody's going to judge you. No one's going to say anything. I don't care, you know, what color you are, what language you speak, what country you come from. You're going to be taken care of here. And that's the best thing about it. So you come in, you get a prenatal care, we listen to the baby, we check you out, we do lab work, we do it all right here. So if you need a pap smear, we get the pap smear. If you need your blood drawn, we get your blood drawn. If you need a referral to see another doctor, to get an ultrasound, we can do that here. You need a prescription for your birth control, we can do it here. If you need to have a breast exam and a referral for a mammogram, we can do that all here, okay? So it's a regular appointment, a regular office visit, a regular exam room. It's just on wheels. I'm passionate about this. Women should not have to feel that they should make a choice on whether or not they should take care of themselves. And that's the lesson that I've learned out there, is that we want to make sure women know that they should be able to be taken care of.
Such a valuable resource. I'd now like to bring on a respected colleague of mine here at University of Cincinnati, practicing physician Dr. Emily Defranco. Dr. Defranco, can you comment on what you're seeing?
So we're very concerned, obviously, with the healthcare disparities and limited access to care, especially really quality maternity care for women that live in rural areas.
Speaking with Dr. Greenberg earlier, she mentioned counties in Ohio where there are few providers and how care and resources are over an hour away. As a specialist in high-risk obstetrics like yourself, and an expert who publishes on racial disparities and social determinants of health that drive these serious outcomes in pregnant women, how do you think healthcare providers could offer access to care across these regional divides?
You know, there are a number of different initiatives that we have tried to implement to improve access to care to women who have limited access. Some examples of those include approaches such as expanding access to telemedicine services, utilizing mobile care units, and increasing utilization of other healthcare providers. We call healthcare extenders, such as physician assistants, nurse practitioners, midwives, and community health workers. Some other initiatives that have been utilized include incentivizing maternal health care providers to practice in rural areas, and also expanding and extending insurance existing coverage programs like Medicaid expansion.
That's wonderful. I think it would be important for any healthcare provider in Southeast Ohio or Washington, D.C. to join this mission and email our Better Starts for All folks. We also heard mentioned that there's other issues at play in these rural areas, including substance use disorder, the lack of transportation and insurance. Which do we tackle first?
That's a really tough question. These are all really important social determinants that negatively impact the health of reproductive age women and pregnant mothers. Addressing all of them and other important social determinants that are known drivers of the disparate maternal health outcomes in rural communities as promptly and as efficiently as possible is really essential to improving maternal and newborn outcomes in Ohio.
So truly, public health initiatives play a crucial role in expanding this access. What other things can you comment on that?
So public health and political initiatives to improve access to maternity care are really very important. One example is the Improving Maternity Care Act of 2018, which aims to optimize placement of maternity care providers in areas with the greatest need. Another example is the Preventing Maternal Deaths Act of 2018, which provides resources and surveillance programs to better understand the drivers of maternal mortality and develop mechanisms to try to address that serious health outcome. However, despite these initiatives, disparate access to care, which is a driver of the disparity in serious pregnancy complications, such as maternal death, persist. More efforts to improve access to quality maternity care across the United States, especially to women who are among those most disadvantaged and living in rural areas in maternity care deserts, are really critical.
There's so many factors to consider. I truly thank you for sharing your time with us today and all the efforts you are doing in this area. Later, we'll hear from public health advocates about their efforts to address some of these disparities. Next, I'd like to bring in someone else who is particularly proud of the work Better Starts for All is doing to help us better understand how to get involved at all levels. Please join me in welcoming RB Senior VP of North America and Europe Nutrition, Pat Sly. Thanks for taking time to join our conversation today, Pat. I'm just going to jump right in and ask you to weigh in on this heavy topic of maternal care deserts and what we can do to start reversing this harsh reality for women and babies.
Absolutely. It is great to be here with you on such an important topic. There is so much work to be done, and every effort by anyone that cares about this issue is helpful beyond measure. In rolling out Better Starts for All in Wards 7 and 8 in Washington, D.C. and in Southeast Ohio, we're going to provide all interested parties with some much needed data on unmet needs that we can then learn and scale from to suit more and more diverse areas. It is our hope and intention to expand services out of these markets as quickly as we possibly can. As for community support, we are always eager to include anyone who feels drawn to help in any way. Right now, the best way to do that includes checking out our Better Starts for All website, where concerned individuals can learn about the program and join the March of Dimes advocacy programs, volunteer, or simply give a donation. Every effort is so meaningful and appreciated, and none are small when it comes to bettering an issue that's this big.
Those are excellent ideas on getting involved, Pat. Thanks so much for bringing those options to our awareness. Obviously, we are both a part of RB, whose mission is to protect, heal, and nurture in the relentless pursuit of a cleaner, healthier world. Let's drill this down to the U.S. and a local level. Tell us about RB's commitment to the program.
Well, as some of you may know, RB houses an entire portfolio of infant brands whose sole mission is to support infants, pregnant women, and new moms during a period that is life-altering for all of them. Our commitment to the Better Starts for All program is reflective of our proven dedication to the most vulnerable members of our society in our unshakable belief that no mother or child anywhere should be denied access to basic care. As a father of 4 myself, this is something I'm so personally very passionate about. Like any parent, I believe my children are the most important people in the world. This fuels my passion to make sure that every baby, no matter where they're born, has the very best start in life. As you so accurately said, Dr. Valentine, we all have the power to contribute to this critical effort. Where someone lives should not influence whether or not their child lives or dies, nor should it dictate the availability of education or resources necessary for a decent standard of living. RB's emphasis on protecting, healing, and nurturing translates pretty directly to what we believe every mother and child require and deserve.
I couldn't agree more, and believe that most people would agree that women and children deserve the best that we can possibly give them always. Thank you so much, Pat, for sharing about those contributions, your own, RB's involvement with Better Starts for All. It's been so good to have your perspective.
Thanks for including me, Dr. Valentine. It's always a pleasure, and I am honored to be part of this mission with you.
We're really all in this together, and it's our strength in numbers and togetherness that will ultimately help us improve the early life quality of babies and the maternal health of women everywhere, no matter their race, income, or zip code. At the start of today's program, we heard from Senator Booker about his gratitude that we are coming together today with a sense of conviction to do more than just discuss the problem. We've heard some alarming statistics, but also some inspiring stories of those already taking action. Let's take a closer look at some of the individual policymakers who've stepped up to the challenge and learn a little bit about those specific strategies that they're implementing in their communities.
I partnered with the March of Dimes and other leading maternal health organizations to address this crisis through legislation like the Black Maternal Health Momnibus Act, where we continue to advance these policies through the Congress. But our moms and our babies cannot wait. which is why the Better Starts for All initiative is so important, making robust investments right now to save lives and disparities and promote maternal and infant health equity in the United States. So thank you for all the work that you're doing. Can't wait to see the initiative in action again soon.
The Better Starts for All campaign is an innovative program that works to increase access to maternity care throughout counties that qualify as maternity care deserts. Through supportive pregnancy care, mobile health services, provider coalitions, and virtual education, the campaign provides these critical resources to those who would not otherwise be able to access them.
We know too many women don't have access to quality, comprehensive, and affordable maternity care. And even before the pandemic, Ohio, as we know, had a serious problem with racial disparities in birth outcomes. Black infants die at 3 times the rate that white infants die. In our state, we rank near the bottom in deaths of African-American infants. These racial disparities, as we obviously know, have only gotten worse during COVID. That's why the work you do is so important, why the Better Starts for All initiative will make a real difference in people's lives. By bringing support and education and clinical care to Southeast Ohio, you help to ensure every mother-to-be that she gets the care she needs. Better access to care means better outcomes for moms, better lives for families. I'll continue to lead on legislation like the Healthy Mom Act and support funding for programs like Healthy Start that will improve outcomes for moms and babies. I look forward to our continued work together to improve access to care and reduce racial disparities. Thank you for being the terrific citizens you are. You're so important in our state and for our country. Thank you so much.
Hi, I'm Congressman Steve Stivers. I represent Ohio's 15th Congressional District, including Athens, Morgan, Vinton, Hocking, and Perry counties. In those rural counties, the infant mortality and maternal mortality is too high. That's why I'm working on the Quality Care for Moms and Babies Act to help bridge the gap. It's great partners like the March of Dimes who are helping us with mobile clinics and virtual care to help make sure we reduce infant mortality and maternal mortality.
I want to thank March of Dimes for their dedication and partnership, and I congratulate them on the launch of Better Starts for All. This initiative will go a long way in improving the lives of our moms and babies across the country.
As we bring all of these informative and compassionate voices we've heard today together, it brings us right back to the first word that unified us all in this program, all. Through our guests and our conversations today, we've been able to view parts of the country that you may never have visited and have been given much needed access to the inner workings of our nation's issue regarding maternal care deserts. All of the voices we have heard today bring us closer to understand how we can embody and connect together all. Whether we are healthcare providers, parents, concerned citizens, or policymakers, we are included in this word and thus included in addressing this critical challenge. There's another word I used a moment ago that needs our attention, access. Access cannot be used in passing when we are talking about mothers and babies. Access has to be for all when it comes to maternal care. The only way for this to happen is for all of us to place intention around ways that we can personally, as well as in our respective professional, social, and advocacy groups, find resolutions to the inequities in care that place women and children at risk during the most critical times in their lives. We need all hands on deck. To get involved, follow Better Starts for All on Instagram, visit betterstartsforall.com, or work with these important initiatives like Momnibus or other volunteer and donation opportunities. Look out for an email from us on ways to get involved, and we would so appreciate any of you that could lend us valuable feedback on our program via the polls provided below. If you're a healthcare provider, please look for us at upcoming medical conferences. Every ounce of support means so much. I want to extend a heartfelt thank you to everyone who joined us today and a special gratitude to all who tuned in to watch. All of you mean so much to our community and will be the driving force behind all that I know we can accomplish in maternal health through Better Starts for All. Thank you and have a wonderful evening.